Assalamu alaikum. My name is Dr. Faisal Anwar. I am Assistant Professor of Ophthalmology in Chief Medical City Hospital and working as Consultant Eye Surgeon in the IQR Lahore. Today we will discuss about the refractive surgery and its components. So today we will be discussing about femto-lasik surgery or femto-lasik laser. So first of all, we will understand the steps that are involved in the femto-lasik procedure. Number one is the patient will come to you in your center for the surgery. The patient eyes will be numbed with the proparac and eye drops for every 2 minutes. So after making the eyes numb, we will ask the patient to lie supine in a spine position and look primarily upwards. And the patient will be looking upward position. We'll ask the patient to feel comfortable and we will apply the speculum into the eye. After applying the speculum into the eye, we will start the procedure. The first step is the docking mechanism. So what is docking mechanism? Docking actually means to flatten the corneal surface or applanating the corneal surface artificially. How we will artificially applanate the corneal surface? It involves a system that includes a suction ring that is applied to the limbal area. So after applying the suction ring to the limbal area, we hold the eye, and there is another lens system that is in smaller in size than the docking suction ring, and it comes to fit into that ring and flattens the cornea or applanates the cornea artificially. The purpose of this step is mainly to flatten the cornea so we can create a uniform flap. So second step that comes after this procedure is the creation of the flap. During the creation of the flap, we use the mixture of carbon dioxide and water that comprises of an expanding gas bubble that is created beneath the layers of the cornea. So that covers the thickness of 1 millimeters in the center and 2 to 3 millimeters the area that it covers. The thickness of the flap can be changed. Sometimes we can create thin flaps and sometimes we create thick flaps according to the corneal bed that is available to us. To create a corneal flap, we create an expanding gas bubble, and first of all the small bubbles that are spread throughout the layers of the cornea, they coalesce and forms a bigger bubble that looks grayish opaque structure. Don't worry about that, that is temporarily. Now the laser will move in a spiral or raster pattern. Now that raster or spiral function will cut the margins of the cornea. After cutting the corneal margins, we will take an instrument that is called as a spatula. That spatula will separate the edges of that flap that is created from the corneal bed. After separating the flap edges, we will take that instrument underneath the flap and move in the forward and the backward direction. After moving throughout the layers of that flap, once we are sure the flap is separated from the corneal bed, we will lift the flap and unfold or move it in a folding fashion at the hinge area. The hinge area is the part of the flap that remains attached to the cornea. So after unfolding the flap, we will shift the patient underneath the laser that is called excimer laser that use ultraviolet rays to disrupt the corneal tissue and reshape the cornea. After reshaping the cornea, we correct your number. Now the area that is reshaped is washed with the isotonic saline. So there is any debris, ablated tissue or any other droplets that remains there are washed away. Now after washing that area, the next step is repositioning of the flap. For the repositioning of the flap, we again take the same instrument, that is spatula, and unfold the flap and place it on the corneal bed. We make we may sometime mark some 2 points ring, like a ring marks, that are necessary, so we can be very sure that the flap that we are repositioning at its actual place or actual position. So after repositioning the flap, what we do, again wash the eye and check for any bubbles, any threads, any droplets underneath the flap. If there are, so we again re-wash the flap and reposition it. After repositioning or rewashing the flap, we take a gauzes. These are gauzes with a stick. We take those gauzes and dry the edges of that flap, so any water underneath the flap will be removed. After drying the edges of the flap, we make swiping movements, and by making these swipe movements, we check the position of the flaps and again reposition it. If we are completely sure that the flap is in its position, we remove the speculum, put antibiotic eye drops, and wait for 2 minutes. After waiting for 2 minutes, we ask the patient to come and sit on the slit lamp so we can re-examine the flap position. Once we are sure that the flap is in its proper position, we ask the patient. Now the patient can leave for home. Patient can put black goggles and can come to us next day for follow-up results. So these are the small and important steps of femto-lasik laser. Hope you will get the required information.